Video is for all of the people who've been emailing me from around the world telling me their struggles, personal stories of mental illness, as well as the stories of people whom they love who battle with mental illness. And the same story is throughout every single email, and that is, when you start feeling really, really good, you want to come off your medicine because you think you don't need it. So listen, the reason you feel good is because you're on your medicine. Don't come off your medication. Over the years, my wife has prescribed lithium, Seroquel, olanzapine, and lamotrigine, something like that. But my goal, I had one goal every day of my life for 7 years, and that was to make sure that she took her medicine so that she could enjoy her life and live a very fulfilled, prosperous life like she did when she was with me. Away from me and with her family, she came off of her medicine, lost 40 pounds in a month, and did something that I regret she did, something I tried to prevent for the past 3 months. But somehow with her family, she was able to accomplish that. And so my lawyer said something months ago. He said, the guilty person is the person who talks the most. I said, what do you mean, the guilty person? In any situation, the guilty one is the one that's always out there talking the most. So just look at that person, because Robbie Stinky Harvey is raising money for the person who's responsible for my wife's death. He's raising money for the person who told my wife she didn't need her medicine. She didn't have to take it anymore. Her doctor was wrong. Her husband's abusive for asking her to take her medicine every single night. And what happened was she lost 40 pounds in a month. She purchased something that I tried to stop for 3 months, and she did something that I tried to stop for years.
All right, so if someone has bipolar 2, schizophrenia, dependent personality, is it normal for them to take medications such as lithium, Seroquel, olanzapine, and latrimazine all together?
Give me what's the names again?
Okay. It's lithium, Seroquel, olanzapine, and lamotrigine.
Okay, so most of those can be used together, especially the lithium with schizophrenia. However, you run into an issue with Seroquel.
Okay.
Seroquel is not really recommended for people with schizophrenia because if you have a bad reaction to Seroquel, it can cause hallucinations and stuff like that, which you're already dealing with schizophrenia. So most of the time, they're not going to put you on Seroquel with schizophrenia.
Continue on east.
Okay. And with
Mica, it can make you have like walk. It can make you like sleepwalk. It can make you do all kind of crazy things you would normally do.
so it would kind of okay. So if somebody didn't have those actual diagnoses and they were taking that medication, all of the medications.
Oh, they'd be a little fucked up, I'm not gonna lie. See, Seroquel is used as an antipsychotic, and it can treat bipolar and schizophrenia and everything, but you can have real bad reactions to it.
And then with lithium, don't you have to have like your blood checked every so often and stuff with that? Like 900 milligrams of lithium, is that a big amount?
Yeah, that seems a little high.
And then if somebody didn't actually have that diagnosis from a doctor, and they were just being like forced to take the medications.
Yeah, I mean, it could really mess with your mental, especially, it can make you feel worse than what you already did. None of the medication seems super abnormal for a patient that has all those conditions. Tell me the other two. What was the other two?
The other two were, let me see. Let me turn my light back on. Olanzapine and lamotridine or LAMOTRIGINE, which that might be the wrong spelling.
I mean, if this person had pretty severe schizophrenia, I could see them being on all of these, because all of these medications pretty much pinpoint treat schizophrenia. And then, I mean, obviously, the Seroquel, I mean, it helps with bipolar and stuff too. But that seems like a lot for one person, unless they're like very, very bad off. Most of the time, you're not going to be on that many antipsychotics for the same thing.
Right. So if someone was like say they didn't have like those actual diagnoses, they're just normal, and somebody was forcing them to take that medication, what?
It could potentially, I don't know if it could kill them. I do know, however, I mean, it can drive them mad, suicidal thoughts. It can cause severe depression, hallucinations, and it depends on the doses. I mean, if they were giving high doses of antipsychotic, I mean, eventually it's going to start wearing on the brain, which can cause, like, I don't want to say brain failure, but it can cause the body to start to shut down. Especially taking to high doses.
And then how hard, I mean, if you're being seen by a doctor and you have like insurance and, you know, money and stuff for it and medications, and you have a pharmacy, how hard is it for a person to get their medication? I know that sounds like a stupid question, but
I mean, it's pretty relatively easy. I mean,
so it shouldn't take like your significant other like bringing it to you and putting it in your drinks and stuff like that, forcing you to take it.
No.
Yeah, okay.
I mean, now, you know, a significant other can pick up your prescriptions, but I don't see the need to where they would have to dose you like that. Because, I mean, you can't dose someone with anything without them knowing it in reality, because, I mean, unless they are that mentally unstable, but if they were that mentally unstable, they should have had a caretaker at that point. And if it's not their caretaker, like on paper, I would say definitely not. I mean, because it's very easy for your significant other to go pick those medications up. But if they was not disabled mentally and needed a caretaker, they definitely should not have been being dosed without their knowledge.
Okay, so if someone didn't have schizophrenia, bipolar 2, and dependent personality disorder, and they were taking those medications, I mean, oh no, that wasn't the question. Okay, so if someone that does not have those diagnoses, or no, they do have those diagnoses and they're not medicated, would they be able to be out in the like real world, like working with kids and like doing actual jobs and things, going on like missions to Africa and things like that?
I would say no. I mean, they would be okay, but I keep going back to again, it would go back to the dosing, how high the doses of everything they're taking. But I mean, it would be pretty. I mean, it calms down people that have those disorders.
Right.
So if someone's taking them that does not have those disorders, you're talking about, you know, like almost zombified, because, you know, I mean, their brain's going to process everything so much slower.
Right.
And then, you know, the spike, especially with the lithium, I mean, it'll make your psychomotor system so much slower that I just don't see where they would want to get out and go through all those things if they were on that many medications and did not need them.
If it was someone trying to control somebody, would that be a good way to control them, is by forcing them with those medications?
I mean, it would definitely make their motor function slower, so I mean, it'd be easier to manipulate in that situation. Okay.
And do you know anything about like medical examiner stuff?
What's your question?
Okay, say after someone passes, like right after they died or even an hour after they died, can they bruise or bleed or anything like that after the heart stopped?
It would depend on how close to death, but bruising, and really no. I mean, you're not really going to bruise after death because when you get hurt and you get bruised, I mean, it's from the blood vessels and stuff being broken there, or from inflammation stuff swelling there, which, you know, the body's going to send blood there to heal that body part, and if the blood's not circulating, you're not going to get bruising. Now, you can get like abrasions, you can get cuts, slices, stuff like that post-mortem, but bruising is not really a typical post-mortem thing to get.
Okay. And then hydroxyne, is that something that's prescribed for anxiety, or is that like something you can get over the counter, or?
Hydroxyne is actually, it is used for anxiety in a lot of patients. I want to say that's one of those drugs that has multiple uses, so because actually antihistamine, but you would definitely need a doctor to prescribe that. You can't just pick that up over the counter. But I mean, it can treat anxiety, and a lot of doctors use it to treat anxiety disorder, especially like generalized anxiety disorder. But it's actually antihistamine, so it's actually for allergies, skin rashes, hives, stuff like that.
Okay. Is that something that would make somebody like groggy or sleepy, or? Oh
yeah, all antihistamines are gonna make you kind of tired. I mean, that's a very big side effect of pretty much all antihistamines, is that it causes like drowsiness. Now everyone's different. You know, some people can take antihistamines and be fine. Other people, you know, it makes them really extremely tired, especially if you're mixing it with other medications. It can cause almost like a sedative effect.
Okay, so if someone was to, like, maybe force somebody to take that to take control over them, or to take them somewhere or something without their knowledge, I guess. I mean, could you use that drug for that?
It would take almost an hour for it to really get its full effect in. But most definitely, especially like depending on the situation of you know, are they in the house, are they in the car, but it will cause severe tiredness, and so, you know, this person will probably be sleeping for most of what's going on, especially, again, the dosing. If it was a high dose of it, it could cause severe drowsiness.
Okay. Now, if someone is on the lithium and that list that I gave you, and they're being injected with testosterone to help their libido, I mean, would that have any interactions or side effects, or would that help a libido in a female?
In a female?
If they're on all the other medications too?
So technically, testosterone can help with the libido issue, because that's why most women get more sexually active the older they get, is because their estrogen levels drop and they have more testosterone in their system rather than estrogen. And so that's kind of why the sex drive picks up more. I will say that's not a very typical treatment for just for libido. I mean, because most of the time doctors don't like giving testosterone out like that.
Right.
I mean, it has other side effects with women that can cause other issues. It can cause, because the reduced estrogen inside your body, it can cause you to go hunchback. It can cause hair growth on other parts of your body and stuff like that. Without knowing the dosing, I can't really say, but I mean, I do know it could increase libido though.
Okay. All right. And would that affect their voice? The testosterone injections?
Yes, it can. It can cause the voice to become deeper, more raspy. That's a common side effect. Like a lot of trans people that use it, they'll kind of get that deeper tone in their voice. Women that's going to men, so it can definitely cause some of that.
Okay. Oh, on like say a coroner's report, like no autopsy, none of that, just the body going to the medical examiner or whatever on the notes. Is it normal for them to list like your past history and like like CBD? Is there a dependency for CBD?
That is one of the more difficult questions to ask. Is there a true dependency for CBD? No. But if there was a high usage of it, some doctors will notate that as a dependency. Even though it's not an addictive substance, some doctors still list it as an addictive substance. So that can be a normal note.
Now, would it be like normal, like say I passed away and like you're the medical examiner? I mean, is there like a way that you can like pull up like all the little details and everything of my medical history and then put that onto the medical exam notes or the coroner report? Or you just list like, how the body and stuff is?
I mean, they're going to list how the body is, damages that was done to the body from, there's obvious damages that happen from certain drugs and stuff like that. If they wanted to go into deeper detail about drug history and stuff like that, they could do a hair follicle sample, which will go back several years.
So they would have to have a hair follicle sample for that information.
Unless it was active in the blood at the time of death, then they can do a blood sample. But now, I mean, if you're talking about something that was 7 years past, that would have to be done through either spinal fluid or through the hair follicle.
Okay, so it's not like something that they would list off like that night or that next day or something of the body being retrieved and at the medical examiners.
Typically, yes. Actually, a lot of times they do a drug panel on the body, just to kind of get an idea of what's going on, the situation that took place. So, I mean, that's not super uncommon for them to do during that report.
Okay, even if it was like a shot to the head or something?
Yeah, they would probably still do it, especially if it's in the form of like believed suicide or believed or homicide. They usually would, in that situation, probably definitely do a drug panel to kind of see if drugs were at play that caused the situation.
Mm-hmm.
So I would say that's pretty common for them to do. Even in that situation, it'd probably be a pretty common practice to do.
Okay, now would the lithium and Seroquel and all that come up on that test, or would that be like a full toxicology thing?
That would be more of a full toxicology on that. Now, if the lithium was too high, that could be a trigger point of, if they had extremely high lithium, then at that point, they could question, why is the lithium so high? And then, they could pull medical records from that point, but I mean, which that would take time. But typically those drugs are not going to show on just a normal drug panel they do, because most of them are they're all non-narcotics. So really, whenever you do that drug panel, you're literally just looking for narcotics.
Okay. All right. And let's see. Now, on the exam for after their pass and everything, is it, I mean, do they actually pull up like the medical records, or do they just go by like whatever family member it is that's in charge at that time, what they say, or?
It kind of depends on the situation of cause of death. The cause of death, how I word that. So if it was a suspicious cause of death, they would probably pull recent medical record to find out what that person was taking, like what their mental health was, stuff of that nature. However, I will say that the person that's in charge of that person, typically their word does carry, because say, for an example, someone commits suicide and the police come there and the paramedics come there to retrieve the body. Well, most of the time, that person, that next of kin, is going to be telling the paramedics, oh, they have a history of this, or they're taking this, and that information does get passed along to the coroner. So it can definitely influence what is said in that report.
Okay, so if they just like off the gate just said suicide, that's it, shut and done.
Yeah, if that person is kind of jumping up and down saying, they have a history of mental illness, they have severe depression, this isn't the first time they've tried this, it's definitely it's not going to directly, I can't say it's going to directly influence it, but it's going to push it in that way. Because then the way that the paramedics and the police and everything is going to look at it is, okay, well, this person has a history of this, it's been reported now, that this has not been the first time that they've tried to commit suicide. So it definitely would push it towards it being ruled as a suicide in place of a homicide.
Okay. All right. And is it okay if I use our interview and post it?
Yes.
Okay.
Yes.
I can keep you anonymous or whatever.
Yes, preferably.
Okay.
And again, with all my comments on the drugs, I mean, the dosage of what was given would play a big factor in it. If these were all low dose drugs, it probably would not have a major effect. But if these drugs were being overused and high doses, I would definitely say a sedative effect. Like that's what you would get in the long run. Is definitely a sedative effect.
Okay. All right. All right.
I hope that helps some.
It does. Thank you so much.
No problem.
All right.
All right.
Bye.
Ain't nothing peculiar about the way that I was raised up.